Hi, I'm Danielle Matias at Caring Medical Florida, and I wanted to share with you today an interesting case that we've seen in the office recently. This was a 65-year-old male with chronic low back pain, specifically in the sacroiliac joint area, which is really kind of like the back of the pelvis. In our office, when people come in with stories like this, we do what we call a DDR, which is a dynamic digital radiograph, commonly called a motion x-ray, that allows us to x-ray the patient doing certain positions that might cause them pain. So in this case, with a rotational view, we get some good images on what's actually going on in that SI or sacroiliac joint. This is the patient's motion x-ray slowed down to about 50% so that we can see it. Right here, this is the right side, this is the left, and right in through here are the patient's sacroiliac joints. So as he's rotating, we'll actually see the joint open up, and we can take measurements as to how far or how wide that joint opens, and we can compare to each side. In general, I don't want to see that joint open up more than 4 millimeters. All right, so anything more than 4 millimeters, I'm going to consider unstable. And what's interesting about the SI joints is patients may say, hey, most of my pain is right-sided. And you might say, okay, I expect to see more of like a right-sided SI instability. But sometimes we actually see more instability on the left, and the right is more painful just from guarding and compensation. So we get a lot of good information from this. This is just a still from that x-ray where I did the measurements of the left sacroiliac joint. As you can see, all more than 4 millimeters. Okay, so unstable on the left side. On the right side, same thing, we did the measurements. All more than 4 millimeters. Seems to be a little bit worse on that right side compared to the left in this patient. Because we know that this patient has this SI joint instability, and we know that there's a lot of ligaments that are supposed to help hold that SI joint together, I recommended treating this patient with prolotherapy to help tighten those ligaments and restore stability to the SI joints. After several treatments in the office, so usually about after 4 treatments, I will re-x-ray the patient, okay? And we'll do the same views again, and then we'll compare to the previous one. So this is the patient's motion x-ray after 4 treatments. Again, I slowed this down to 50%, and again, we're looking to see how wide that SI joint opens, and then we compare to the previous one. So these are stills from the new x-ray. Looking at the left side first, remember all these measurements greater than 4 millimeters. This is the new measurement on the left side, less than 4. Okay, so now he has a stable left SI joint. On the right side, after 4 treatments, less than 4 millimeters. Okay, so prolotherapy was successful at tightening the ligaments around the SI joint and stabilizing those joints in that patient. I love graphics. I'm a visual person. So this just kind of shows you all of these ligaments that help to support and hold that SI joint together. It's not just one ligament. It's a whole network of all these soft tissues that should provide stability. So you can imagine if you have all these ligaments and they're just unable to do their job and unable to hold that posterior pelvis together, patients are going to have a lot of pain and a lot of dysfunction, especially if they are doing something or in a position that really needs stability there. So think about a golf swing. Other patients, you might think of like loading the dishwasher, or doing laundry. Any of that kind of like rotation, bending positions will aggravate that area. So in summary, in this patient, again, 65-year-old golfer, male, dynamic imaging was useful in helping to diagnose the patient's condition and monitor their progress. We can see that it was unstable and that has become stabilized after prolotherapy. Prolotherapy was appropriate for strengthening these loose ligaments, obviously. Another point I want to make is you're never too old for prolotherapy. So like this patient was 65. I would not consider him old, but I do get that question a lot. Like, am I too old? Is my body too old to heal from these treatments? The answer is no. And it is possible to successfully overcome your chronic pain and get back to the activities that you love.